Notice, the people appearing in the video are for illustrative purposes only. They may not be real doctors or patients. Thank you. Substance intoxication, also known as drug intoxication, occurs when a person consumes a substance in quantities or with methods that overwhelm their physiological systems. This state is characterized by an array of symptoms that vary based on the type of substance, amount consumed, individual's body chemistry, and tolerance levels. Understanding these symptoms is crucial for recognizing potential dangers and seeking appropriate help. This video provides an overview of the general symptoms associated with substance intoxication, though it's important to note that specific symptoms can vary significantly with different substances. Altered mental state. One of the most immediate and noticeable symptoms of substance intoxication is a change in mental state. This can include euphoria, a sense of heightened energy or alertness, or conversely, feelings of relaxation or sedation. Some substances can lead to a decreased ability to concentrate, impaired judgment, and memory lapses. In more severe cases, intoxication may cause confusion, hallucinations, delusions, or even psychosis. Physical symptoms. Substance intoxication often manifests through various physical symptoms. These can include slurred speech, unsteady gait, lack of coordination, and impaired motor skills. Depending on the substance, there may also be physiological reactions such as increased heart rate, elevated or lowered blood pressure, sweating, tremors, or seizures. Some substances can cause respiratory depression, which is particularly dangerous and can be life-threatening. Behavioral changes. Intoxication can lead to significant changes in behavior. This might range from disinhibition and risk-taking behaviors to aggression or apathy. The individual might engage in unusual or risky activities that they would normally avoid when sober. Some substances can induce a state of heightened aggression or irritability, while others might lead to a withdrawn or depressive state. Sensory effects. Many substances alter sensory perceptions. Users might experience enhanced or dulled sensory input, which can include visual or auditory hallucinations. Some substances might lead to a heightened sense of well-being or pleasure, while others might induce unpleasant sensations such as nausea or pain. Psychological impact. Substance intoxication can have significant psychological effects. Users might experience intense mood swings, anxiety, or panic attacks. Feelings of paranoia or intense fear are common with certain substances. Long-term substance use can lead to more severe psychological issues, including chronic anxiety, depression, or persistent psychotic disorders. Risk of overdose. A critical concern with substance intoxication is the risk of overdose, particularly with substances like opioids, alcohol, or sedatives. Symptoms of overdose can include extreme drowsiness, loss of consciousness, seizures, difficulty breathing, and in severe cases, coma or death. Causes of substance intoxication. Substance intoxication, a state of altered mental, physical, and emotional functioning due to the influence of psychoactive substances, is a complex phenomenon influenced by a multitude of factors. These factors range from the pharmacological properties of the substance itself to individual, environmental, and societal influences. Pharmacological factors. The foremost cause of substance intoxication is the chemical nature of the substance. Different substances have different mechanisms of action in the brain and body. For instance, alcohol, a central nervous system depressant, works primarily by enhancing the effects of the inhibitory neurotransmitter GABA. In contrast, stimulants like cocaine and amphetamines increase the activity of neurotransmitters such as dopamine and norepinephrine, leading to heightened alertness and energy. The potency, dose, and method of consumption, such as inhalation, ingestion, injection, also significantly impact the level and intensity of intoxication. Genetic susceptibility. Genetics play a critical role in how individuals metabolize and respond to substances. Genetic variations can influence the likelihood of developing substance use disorders and the severity of intoxication. For example, certain genetic profiles may metabolize alcohol differently, leading to faster intoxication or increased risk of addiction. Psychological factors. Mental health conditions like depression, anxiety, and personality disorders can predispose individuals to substance use as a form of self-medication. The temporary relief from symptoms can lead to repeated use, increasing the risk of intoxication. Additionally, psychological traits such as impulsivity and sensation-seeking behavior are associated with higher risks of substance misuse and intoxication. Social and environmental factors. Peer pressure, societal norms, and cultural attitudes towards substance use significantly influence individuals' likelihood of using substances. Environments where substance use is normalized or glamorized can lead to increased consumption and, consequently, intoxication. Additionally, stressors such as socioeconomic hardship, trauma, and exposure to environments where substance use is prevalent can contribute to increased use. Tolerance and dependence. Regular use of a substance often leads to tolerance, requiring larger doses to achieve the same effects. This escalation in use can increase the risk of intoxication. Dependence, both physical and psychological, can also develop, making it difficult for individuals to reduce or control their substance use, further elevating the risk of intoxication. Age and physical health. Younger individuals, especially adolescents, are more susceptible to substance intoxication due to their developing brains and lack of experience with substances. Additionally, older adults may experience enhanced effects due to changes in metabolism and the presence of other medications. Physical health conditions, such as liver or kidney disease, can also affect how substances are metabolized, leading to increased vulnerability to intoxication. In summary, substance intoxication is not a simple consequence of substance use, but rather the result of a complex interplay of pharmacological, genetic, psychological, social, and physiological factors. Understanding these multifaceted causes is crucial for effective prevention and treatment strategies. Diagnosis of substance intoxication. Diagnosing substance intoxication involves a multifaceted approach, primarily focusing on clinical assessment and toxicological testing. Clinicians rely on the individual's history, physical examination, and behavioral observations to identify signs of intoxication, such as altered consciousness, mood swings, impaired motor coordination, or speech difficulties. These symptoms vary depending on the substance involved. For a definitive diagnosis, toxicological screening through blood, urine, or breath tests is often employed to detect the presence and concentration of the substance. It's crucial to consider the context, as similar symptoms might arise from other medical conditions. The diagnosis also involves assessing the duration and severity of symptoms, which helps in determining the appropriate intervention and management strategy. Accurate diagnosis is essential for effective treatment and ensuring the safety and well-being of the individual. Treatment for substance intoxication. Treatment for substance intoxication is multifaceted, tailored to the specific substance involved, the severity of symptoms, and the individual's overall health. It generally encompasses immediate stabilization, detoxification, and long-term rehabilitation strategies. Immediate stabilization. The primary goal in acute cases of substance intoxication is to stabilize the patient's vital signs and address any life-threatening conditions. This may involve managing respiratory depression, cardiac arrhythmias, or seizures. In cases of alcohol intoxication, this might include administering intravenous fluids to prevent dehydration and electrolyte imbalances. For opioid overdose, healthcare professionals might use naloxone, an opioid antagonist, to reverse the effects. Detoxification. Detoxification is the process of safely withdrawing the substance from the body, often under medical supervision. This stage may involve the use of medication to ease withdrawal symptoms and prevent complications. Detoxification programs vary in length, depending on the substance and severity of dependence. Psychological support and rehabilitation. Addressing the psychological aspects of substance use is crucial. Counseling, cognitive behavioral therapy, CBT, and other therapy forms help individuals understand the underlying causes of their substance use, develop coping strategies, and prevent relapse. Support groups like Alcoholics Anonymous, AA, or Narcotics Anonymous, NA, offer peer support and a sense of community. Medication-assisted treatment, MAT. MAT combines medications with counseling and behavioral therapies to treat substance use disorders. It's particularly effective for opioid and alcohol dependence. Long-term management. Long-term treatment involves continuous support and monitoring to maintain sobriety. This includes regular follow-up appointments, ongoing therapy, and sometimes continued use of medications. Lifestyle changes, such as adopting healthy habits and avoiding triggers, play a crucial role in preventing relapse. Family and community support. Engaging family members and the community in the treatment process can provide a supportive environment that is vital for recovery. Educational programs for families help in understanding substance use disorders and how to support their loved ones effectively. Treatment of substance intoxication is not a one-size-fits-all approach and requires a comprehensive plan addressing the physical, psychological, and social aspects of the individual's life. The ultimate goal is to help the individual achieve and maintain a substance-free life, improving their overall health and well-being. Warning: we are not responsible for any medical outcomes. Please seek a professional for diagnosis and treatment. And that's a wrap for today's video. Thank you so much for watching. If you found it helpful, please give it a thumbs up. Don't forget to subscribe and hit that bell icon so you won't miss any of our upcoming content.